And right now, it's all about the health segment. And today, we are going to be talking about something very important. And as you all know, it's the Breast Cancer Awareness Month. So it's important for us to have this discussion. Ladies and gentlemen, we are talking breast cancer today. And joining me in the studio is Dr. Henry Birchie. He's the Senior Medical Officer at the Raphael Medical Center. Good morning, Doc.
Good morning.
How are you?
I'm very fine.
All right, first of all, before we get into, all the juicy information about this topic, what does the Awareness Month really mean to you?
All right. I will come from the point of view of trying to talk about what awareness is. And awareness is simply making people know about something.
Yeah.
And specifically applying it to breast cancer and liaising it or linking it with its incidence and the deaths that it brings.
Yeah.
It's very important that such a month should be put in place to let people know about it and ways to even prevent the disease. So that is what I would say the importance of the awareness month is concerned.
All right. Okay, so let's talk breast cancer. What is breast cancer?
When we talk about breast cancer, it's a growth. As much as possible, I want to be very, very simple when I'm communicating, since I'm communicating to largely a lay audience.
Yeah.
So it's a growth of the breast tissue, and it contains certain cells, or the basic units are abnormal cells, and they have certain characteristics such that the cells divide very fast compared to the normal breast tissue. And the danger is that it has a tendency to spread to the surrounding tissue or organs, and also able to move to distant organs such as the lungs, the brain, the bones.
The brain?
Yes, that is why cancer is dangerous. Any form of cancer can spread to distant organs. So from head to toe, the brain, even the skull here, the bones, and what have you.
Right, right. So how frequent is breast cancer?
All right.
Especially in our environment here in Ghana.
Okay.
Maybe then we can talk about Africa, but in Ghana.
Okay. I would like to start from top and come down.
Yeah, sure.
So globally, according to WHO, in 2020, there were about 2.3 million new cases of breast cancer among women. And out of this, there were 685,000 deaths. And that is more than 500,000. That's what we are talking about. So that's how dangerous the disease is. And when we come home, Ghana here, the incidence rate, when I say incidence rate, we are talking about new cases. We may have already existing cases, but new cases annually, you can have about 23 new cases among 100,000 population. And in terms of, that is a ratio, but let's talk about numbers. One source talks about having about 1,413 new cases annually, and another source also talks about more than 4,000 new cases annually.
Right. All right. This is just a question that I have in my head right now, thinking about what you said. How many have you treated, or how many patients have you seen that have breast cancer?
I've been practicing this trade for 13 years now, but actually, because cancer treatment is more to a specific group of doctors, that's the specialists, the surgeons, and those people deal with chemotherapy and radiotherapy. I, at my level, will see and end up referring, so I will not be able to tell you the numbers I've seen, but at least one that I think I was glad to have seen and quickly sent when I was in Winnipeg practicing in 2014. The person came quite early. It was just a month old, and I quickly sent to Kolebu Teaching Hospital, where the tumor, the cancer was removed, and the patient is still well and alive. Okay,
so now how does it manifest itself? You just talked about tumors. Is it only by the tumor that we'll know that, okay, this is, okay, probably we need to go and check ourselves?
All right.
Yeah.
So as I defined earlier, it's a growth, a swelling. So typically a breast cancer would manifest as a keyword is painless. You don't feel any pain. Painless swelling in the breast. Mostly tend to happen more on the outer We divide the breast
the
into
outer
four
side of it.
outer upper quadrants. That's most often. It can happen in all.
Anywhere.
Yeah, but most often in the upper outer quadrants. And so you have a painless mass which is hard, and the edges are rough or indefinite. In few cases, they may be soft or firm, but key thing to note is it has to be hard and painless. So when you see that, you quickly report. So that's at this early stage.
Right.
But when the disease begins to spread, as I said, I spoke of local spread, the surrounding tissue. So the cancer can pull on the nipple and draw it in.
Yeah.
So that you have something.
So invert it. It inverts the nipple.
Yeah, so we have a nipple inversion or retraction, and also can even pull on the skin. And on the skin, so these are this early stage, whereby you are not seeing any change in the skin of the breast. It's just the hard mass
just
there.
A little tumor down. Yeah.
Yeah. I don't know if we can move on.
Okay.
So we have one, as I said, we have a nipple retraction whereby the cancer is able to pull the nipple inwards, and also the skin. So this, the one here is the nipple retraction, and is the normal breast. Then you have one also whereby the skin of the breast is pulled in, like you form a dimple. So we have the dimpling or the puckering of the skin.
Is it the one that they say poil d'orange, the one that looks like the orange peel?
That one is different.
Oh, okay.
So as you've just said that, let me just quickly comment on that. So if you can imagine how the orange looks like, the orange skin appearance, it has some small pores on it. And so that's what we call the poil d'orange or the orange skin appearance of the skin. But that is, I think I have a black and white picture of that.
Yeah.
So when we get there, then we could also have nipple discharge, abnormal nipple discharge when it's bloody. And some
when it's bloody.
Yes. So we know nipple discharge at least has to be clear.
Yeah.
So these are this is more of a cartoon-like appearance. Some of the skin, you have a change in the color of the skin appearing as red. So these are local spread. To the extent that even the local spread, you could have an ulceration, a deep wound. When you say ulceration, a deep wound of the skin around the breast. So.
And that's just the beginning stage.
Or that one at least that's a local spread. So that's an advanced stage.
All right, but is it curable though?
All right. I would say it's curable, but the message we want to sound or we want to echo is let's report early. That is where the issue is. If we report early, we can do a lot for you and you will be well and alive, because we have various treatment modalities, which ranges from surgery to chemotherapy to radiotherapy, where we use radiations, and we also use hormones, hormonal therapy. So we have a number of treatment modalities, but the key thing is let's report early. So when we report early, the disease is not likely to spread, as I said, giving you those ulcerations or the deep wound and the skin being drawn in and all those stuff. At that stage, the disease has spread.
Yeah.
And we also don't want you to present whereby you have become paralyzed because the disease has spread to the spine.
Paralyzed?
Yes, it can cause paralysis. And can spread to the brain, so that the tumors now will be found, or the cancers will be found in the brain. Yes, that is this. So that is at that stage.
That's a very deadly disease.
Yes, it is. So that's why we are encouraging. Let's quickly report, and that is why our take-home message we would like to take, even if I bored you with all those technical or few technical terms, the key notes messages we need to, chew on and apply.
Right, right. So how do we self-inspect?
Okay.
I mean, every year we hear this, so I'm sure there are people who are watching that maybe have never heard it before or probably forgot how to do it. How do we self-inspect?
All right, so before or to tackle that question, that's one keynote message. So, so thank you, interviewer, for already trying to tell us some of the key. So one thing we would like to recommend is at least let's regularly do self-breast examination or personal breast examination once in a month or once in 2 weeks. So now, to answer your question, we'll divide the breast into 4 parts, so quadrants. So let's use the midline where the nipple is to draw a straight line, and another, so a straight vertical line, and another one horizontally.
Yeah.
So that gives you the 4. So that, remember I mentioned of the upper, outer quadrant, and
yeah.
we have the upper inner.
Yeah.
So we have the
Lower
inner,
yeah,
and lower outer. Then lastly is around the nipple. We have the area we call the areola.
Yeah.
So using the flat of your fingers, and ideally, in the clinical setting, we want your bed to be inclined.
You're lying down.
Inclined at 45 degrees. Okay. That's the best situation. But if it's not possible, sitting is best. Or if you are not able to do that, at least you can lie down. That is in the clinical scenario. But as I said, the best position is at 45 degrees of the body inclined. So with the flat of your finger, or at home, if you can just lie down, as you said. So with the flat of your finger, you tackle each of the quadrants.
Yeah.
So you start, maybe if I'm starting at the upper outer, then I go palpating. Some are bigger. My hands are smaller. So imagine I see a very, very hefty woman. Yeah. So you try not with the tips. Let me just re-echo that. With the tips, you will miss it. So it has to be the whole of the flat of the fingers.
Okay.
Taking each quadrant and moving to the next, and moving to the next. Still you deal with all the 4. Then lastly, you come to where they're around the nipple.
Yeah.
So if there is a mass, if you do it very well with the flat of your finger, there is no way you'll miss it. And also you can also squeeze around the nipple to see if there's any discharge. Because we know that disease can spread, as I said earlier on, sometimes you may have lymph node, but we don't.
Right under your armpit.
So you need to also examine the armpits to see here and also above.
Where your lymph nodes are.
Yeah.
Okay.
But that is an advanced stage. But as I said, that is why we're encouraging personal breast examination, so that at least if you're able to do these 4 quadrants and around the nipple, at least you should be able to pick.
I mean, and I think if you can't do that, like since it's the awareness month, I'm sure there are a lot of clinics that are doing free checkup. So I think you can just walk into any clinic and go and check. But there's a myth that I just want you to clarify right now, that men don't get breast cancer. Tell me, what's the fact?
All right. Breast cancer is also among men.
Thank you.
And I don't know how I should put the percentage, but at least when we were in school, I remember 1% of that. By just reading recently, we could have between 1 to 2.6% of breast cancers among males.
Right.
And because it's not common among males, even when it happens in the male, it's more even deadly. Yeah, and more aggressive compared to that of the females. So even as we are creating awareness regarding breast cancer, it's not only exclusive to females. Yeah. Males are exclusive. So I was happy with one of our cameramen following me.
The man behind the camera, he was also,
and I'm so glad that he's learning something.
Right. So it's just the same way that the men also have to examine, right?
Yes, please.
And usually, is it right after our period, or we have to do it every day?
Well, so as I said earlier on, at least once in 2 weeks, or if you don't have the time, once in a month.
All right. Okay. Thank you so much. Any take-home message apart from that?
Whilst you were asking me among males, I was so glad with my interviewer giving me the take-home message again, saying that there's a need for us to go to an accredited health facility to have a professional assess the breast for us, at least if once in a year or twice in a year. And whilst we also examine and we find anything suspicious, we need to report very, very early. The key word is early detection, so that we report early, so that, treatment will be initiated and the disease is not likely to spread. And I know they will not even affect the cost of health to the individual, to the family, to the nation as a whole. Yeah. So early detection, quick decision to report to health facilities, what we want to echo. Okay. Thank you very much.
Thank you so much, Dr. Raf. Thank you so much. I really appreciate it. All right, ladies and gentlemen, you've heard him. All you need to do is go out there to the clinics, especially right now that it's the Breast Cancer Awareness Month. There's so many clinics that are running free tests. So just look out for one, go out there and then check yourself. But if you can't go to any of the clinics, remember to also try to self-inspect. And he just demonstrated how to do it here. And it's not only keen to women. Men also have breast cancer and it can be deadly too. So it's very important for you to self-inspect. Thank you so much, Doc. It was really nice having you on the show. But how can people reach out to you though, if anybody wants to reach out to you?
This man doesn't like social media plenty.
Yeah.
All right, maybe I'll just leave my number.
Yeah, okay, sure, no problem.
0243 140
Yeah.
770.
Okay.
And you can also visit me at Rafa Medical Center, situated in Tema Community.
Okay, thank you so much. All right, so we've been talking to Dr. Henry Berchi, Senior Medical Officer at Rafa Medical Center, and it's been about breast cancer.